Hello, everybody. Welcome back. Carlene Ponder, Director of Disability Rights and Housing Policy with the ARC of the U.S. Thank you all for bearing with us. I know we shortened our break just a little bit, but I hope you are engaged. You got some food with you, maybe some caffeine. I needed some caffeine. And we're really going into the solutions part of today's conference with this next panel. So I'm excited about that and shifting gears to hear what we can do as individuals, as communities, as organizations around the issue of crisis response. Just a little bit of housekeeping. We have questions can be put into the Q&A. That is the best function. Also, if you are taking part in our workshop where we are prompting you to do some digging in your own local community, Juan has updated the question in the main lobby chat. So we're now on to question 3. And we hope you'll come back at the end of the day and give us some of the information that you found about your own community. And I think that is about all that I can remember at this point. So I am ready. Greg and AJ, how do you want to handle questions? Do you want me to read questions to you, or do you all just want to kind of go in and grab your own questions?
This is AJ. I'm comfortable with whatever. I won't be able to see questions while we're presenting though, because I'm sharing my screen.
Yeah, so I think if you can read them at the end, I think that may be the best way to approach this.
Okay, and I know that people are still coming in, so let's give people just a few minutes as they come back from our shortened break session. Back into the room where we're on our panel, the inadequacy of training, police interactions with IDD, which is intellectual and developmental disabilities, and mental health disabilities. And I will just go ahead and read to people what our third workshop question is of the day. If you follow the bit.ly link, which I think should be in the main lobby chat, you will see this question. So if you've already done the first 2 and you found an answer, this is for communities that have a mobile crisis response available. If you have a mobile crisis response available, can you, or whoever the caller is, request a mobile crisis unit directly in lieu of a police response? So can you call and say, I want a mobile crisis unit, I don't want police? How's that, So we're asking people to answer that question for us. Okay. And Juan has also posted it in the chat here. Well, without further delay, I am going to turn it over to our speakers, AJ Link and Greg Robinson, to introduce themselves and to introduce the session. And I am going to disappear from the screen for a little bit. Okay, take it away.
Thank you so much, Carlene. I'm going to share my screen, y'all. This is AJ speaking. Cool. Hi, y'all. I'm AJ. I have on a pink hat and a black shirt, and my background is black with the logo for the ARC behind me. I also have a beard, and I'm here with Greg Robinson. And today we're going to talk about the inadequacy of training, police interactions with IDD and mental health disabilities. So a quick overview. Our presentation's only about 10 slides long. We're going to give an intro of ourselves and our organization. We're going to talk about the new 988 rollout. Then we'll talk about why more IDD awareness isn't enough to protect disabled people during police interactions. And then finally, we'll talk about alternatives to police-centered responses, and we'll do some Q&A afterwards.
Hi, I'm Greg Robinson. I'm the Deputy Director of Public Policy for the Autistic Self-Advocacy Network. And a brief visual description, I am a brown-skinned man with short curly hair, glasses, and I'm wearing a gray suit with a purple striped shirt. And behind me is the black background with the ARC logo. As I said, I'm the Deputy Director of Public Policy for the Autistic Self-Advocacy Network. With me is AJ Link.
I'm a policy analyst at ASAN, and I have a wide portfolio, including crisis response.
The Autistic Self-Advocacy Network is a autistic led, autistic run disability rights nonprofit that is focused on support, fighting for the rights of autistic people and autistic communities, including making sure that autistic people are included and represented in policy making, and that laws and policies meet the needs of our communities. We support self-advocacy and change in the way people think of and view autism, and really just focusing on ensuring that autistic people are making their interests heard on a policy level, including as it relates to policing and safety.
This is AJ. Thank you, Greg. So 988 has rolled out over this summer, past couple months and weeks. It is based in the 988 Implementation Act, and there's a bill that's been introduced to kind of help and expand the program called the 988 and Parity Assistance Act of 2022. One of the other pieces of legislation is the Behavioral Health Crisis Services Expansion Act. And what 988 does is it replaces the longer 1-800 number for suicide prevention. So it's a national hotline where you can call. And the goal of 988 is to have 24/7 crisis intervention services and supports, and it's a free service. 988 has been designated as a 3-digit universal number to replace the longer number. And what the goal of 988 is to do is to provide crisis response and support that is not police-centered for people who are experiencing mental health crises. So the goal is an alternative to police-centered response, but as we'll talk about, there have been some problems with the 988 rollout so far.
So first, I do want to emphasize that there are some really good things about 988 as a service and a number. One thing that the disability community has really fought to make sure was included were accessible ways of accessing 988. So it is available for deaf and low hearing callers through TTY calling, dialing 711 and then 988. It's also available in a large number of languages, over 150 languages. In addition, there's a lot of work on interfacing text options for people who may not be who may not speak. That being said, there are some very real and serious limitations around 988 as it's currently implemented. The biggest one is that police are still a presence here, and and the implementation really varies a lot between different states and locals. Not every state has enacted 988 implementation legislation, so there isn't even a lot of standardization within states. There's not a lot of transparency about how that implementation works. This does mean that there's a pretty significant inconsistency, not only in what's available, but what people may know is available from one local one state to the next. That does include whether police are involved, which is a real struggle here. People may, in places that do have robust alternatives to policing, that crisis response may be built into that system. But if someone with that expectation goes somewhere else, they may expect a non-police response and get police. This is also an issue in places where crisis teams are not 24/7. Where calls may be routed to police response outside of crisis team hours. Similarly, a lot of rural communities also don't have well-developed crisis response systems, so they're often left out of that as well. But one thing I really want to emphasize here is it's not just that some states really have robust crisis response and some others, but also that itself is a problem, because it means that public expectations around who's responding when you call 988 may not hold if from one location to another, and that impact on those expectations creates itself a pretty significant access problem.
Yeah, and so what we want to talk about is how, even though 988 is available, police can be involved in crisis response, and how that crisis response is often deadly for disabled folks. So there's a bunch of statistics on the page right now. I won't read through all of them, but some of the highlights are that disabled folks make up 1/3 to 1/2 of all people killed by law enforcement officers. And so another statistic is that 1 in 5 fatal police shootings in 2019, which is the last year that we could find data, involved a person with a mental illness. So that is a mental health disability. So disabled folks are disproportionately represented in terms of police use of force that ends in death. And this is more true for Black folks and Black disabled folks. And so oftentimes when Black folks or other people of color are experiencing mental health crises and police are called, it leads to police use of force and potentially deadly use of force. And some of the statistics on the slide show that Black men are more likely to face this harassment or this use of force. Something else that we really wanted to cover is that mental health disabilities are overrepresented among those in jail and prison. The statistic says that people with serious mental illness comprise 4 to 5% of the US population, but they make up 15 to 20% of prison and jail populations respectively. And so what that means is that they're experiencing encounters with law enforcement at a higher level. And I just wanted to give that background before we go to the next slide.
So one proposed response that we often see is, and in fact, one form of 988 implementation that we're particularly wary of is models that involve co-response, but also models that involve cross-trained police who comprise a specialized crisis response or social service response unit. We are, in general, law enforcement response should be limited to individuals who with mental health disabilities who are in need of supports and services. That is because the role of police, the primary training that police have, and their primary role is to investigate, detain, and if they deem it necessary, use force to do so. That does mean that any interaction where police are present, there is a directionality to police procedures that can lead to use of force in an environment that may not need it, among others. And that is, again, because the primary role of police is to investigate and detain. And studies do bear this out, that training officers in crisis with crisis intervention training very little consistent data showing that it actually improves outcomes, especially around arrest or use of force. And in fact, one study did find that of the Chicago Police Department did find a marginal increase in overall use of force among crisis intervention trained officers. And some of that may be that those officers were more frequently present in situations with people with mental health disabilities, and thus were a selection of officers that were more likely to use force, but that itself is the problem. Moreover, repeat contact with police officers presents an intrinsic problem wherein the presence of officers to people who have previous traumatic interactions with law enforcement can themselves be re-traumatizing. They can also lead people to, out of fear, out of trauma, act in ways that are read suspicious to police and then further escalate, or otherwise may cause additional distress to somebody who is interacting with police, given that traumatic history or other fear or concern for their safety. So those are all things that the presence of police itself in crisis situations can in fact escalate situations and lead to greater possibility of harm and use of force.
Hi, this is AJ. I'll wait for Jenny to get ready. Cool. So we wanted to talk about some alternatives before we left. It's not all doom and gloom, but there's some work that needs to be done. One of the major alternatives are warm lines, and warm lines are staffed by folks who are called peers, and they are people who have experienced mental health challenges and crises themselves. Warm lines focus on emotional support to prevent future crises. It's not necessarily crisis intervention in the middle of a crisis incident. And we've posted some links, and I saw that in the chat people were asking for links. As soon as I'm done presenting, I will copy and paste them into the chat for everyone. Another alternative is the CAHOOTS model, and CAHOOTS stands for Crisis Assistance Helping Out on the Streets. The CAHOOTS model uses unarmed teams, and they include medics. I don't know why it says medicas, but medics, social workers, and sometimes they include peer responders, like on the warm lines, and they're dispatched instead of the police. There are different programs out there. There are models in Oregon and San Francisco, and I want to say Denver just had a new model come out. And so with these models, it's really focusing on what Greg talked about, is not having police-centered response to crises, or not even having police overlap or assistance. But something that we're really concerned about at ASAN is having larger policy solutions. And that includes investing in things like HCBS, which are home and community-based services, affordable and accessible housing, because we know that that kind of stability is really good at preventing really I guess problematic crises. And it's really important that we have adequate funding for these larger policy solutions, because if they're implemented properly, they're also really good at saving time and money and preventing these things from happening. So if you're investing properly in HCBS and affordable housing, then you're oftentimes saving money when it comes to things like ambulance services and things like that. And so there are lots of different alternatives, but we just have to, introduce folks to these ideas and these possibilities, but to also provide adequate funding for these, so that even in places where 988 isn't fully implemented, we don't have situations where police are responding, even police that have CIT training. And so here's a list of other resources that have either CAHOOTS models or warm lines. I will post these links in the chat when we're done, but that is it for us. And we can go to Q&A, and I will stop sharing.
Great. Thank you. I'll come back on. And I see that we have some people who are doing the homework. We had one person put in the chat in response to the question that we had asked about whether or not a caller could ask for a mobile crisis team, or if they had the option to ask for a mobile crisis team in lieu of a police response. And so Jacqueline Turner did the homework, and she said that in her community, we can call the vendor for a mobile crisis unit directly. AJ and Greg, as a policy solution, I know you all were talking about how 988 is still very much linked to police in most cases. What do you think about that? Being able to call a mobile crisis unit vendor directly?
Well, I think the one challenge there is it does sort of defeat the purpose and intent of a universal number that everyone knows to call and use. And I think one concern I have is just that we really do want to make sure that ease of use is also built into this, that people who are experiencing crisis can voluntarily seek support and know who is responding, and having access to, being able to call a vendor may help. I think mainly helps caregivers and support staff. It may not help somebody who is experiencing a crisis in the moment, especially if they're not aware of what resources are out there. So I think that is one thing that I would just want to flag, that I think that helps address the need for crisis response, but it isn't necessarily the most accessible route, especially for someone who isn't already connected to services.
Oh, okay. So you're emphasizing the fact that you may need a crisis response immediately, but sort of what happens after that. Is that what I heard?
And just ease of use, familiarity with the line. I think, again, a lot of local mobile crisis have definitely made it a point to do what they can to make sure that their communities are connected, but it is shifting the resources from this federal initiative to have a universal line to those local community resources. And I think, again, if the purpose is to have a universal, well-known, accessible route to seek services, then we're kind of underutilizing that process if we are still requiring local agencies to pick up that slack.
And then I see this question. This is excellent. This is from Laura. She says, my community in Oregon is pursuing a crisis intervention training model. And for those of you who don't know, crisis intervention training is a form of mental health, maybe disability training that police get. It varies in terms of what's offered and how long it is. In some communities, crisis intervention training can be 1 day, it can be 8 hours. There is no national standard. So Laura says, my community in Oregon is pursuing a crisis intervention training model rather than a CAHOOTS model. And for those of you who don't know CAHOOTS stands for Crisis Assistance Helping Out on the Street, founded in Eugene, Oregon. It is a model where crisis workers, they can be social workers, they can be counselors, and I think that they may have peers, I'm not sure, actually go out into the community and respond to a significant portion of mental health involved calls and other things. I think they also go out and address other issues in the community besides mental health, therefore diverting those calls away from a police response. So that's the CAHOOTS model. So she says, I prefer the latter, which is the CAHOOTS model. Do you have any reports that discuss the pros or cons or effectiveness between CIT, crisis intervention training, which I understand includes the police, versus CAHOOTS? And if you don't have any studies, do you have any thoughts around that CIT training versus a CAHOOTS model?
Yeah, so this is AJ speaking. I don't know of any studies yet comparing the two. And I think it's really difficult because when you're asking for CIT data, that is police data, which is historically really not reliable. And so it's really hard to get a good sense of a compare and contrast of what's quote unquote working for communities and what isn't. And so I would be really interested to see a study like that. I know from a personal perspective, having a community-based response that is not involving police is generally better suited, especially for those experiencing crises and mental health crises, simply for the fact that there's not the threat or the actual use of force on the people experiencing mental health crises. So I would love to see the data, but I don't know the study that's out there right now.
And you're also saying that there might be some concerns because we would be relying in large part on police data for the CIT training piece.
Yeah, and I know that we are currently working on a federal policy level to address some of the police use of force reporting issues, which again have historically been spotty. There's a lot of non-compliance across departments. I do know in terms of comparing the models, though not necessarily, again, not necessarily providing data, but giving a comparative of the sort of structure of the various models and where they're implemented. The interrupting criminalization link that we shared does have a good guide and overview of diversity of models that have used. They do discuss both crisis intervention training to some degree, but also these other models that are being employed, including CAHOOTS models and peer-led initiatives. So I think that at least gives an overview for discussion there as well.
And then we have a question from the YouTube, which I'll answer because it's more of a technical question. It is, what's the difference between 988 and 711? 711 more than, well, unless you did reference 711 directly. Did you want to? Well, my understanding is that 711 is probably a local, it was probably a local number that was instituted prior to 988. In my community, we have 311. Some communities have 211. And those are supposed to be non-emergency numbers that people can call, not just for mental health issues, but other issues as well. 988 is a new national 3-digit number that is specifically for mental health and suicide prevention and substance use issues. It is supposed to feed directly into
yeah, Carlene, I'm so sorry, but no, 711 is the text telephone number. So you dial 711 and then 988, and then you can, and this is for non-speaking or folks who maybe don't speak, so they can use the touch tone to text to communicate.
Likewise, for people who are not have low hearing or are deaf. So it's a text-based telephone relay service.
So ignore everything I said. It's a text to relay service. All right, let's see. Someone is asking about problems related to calling 988 from cell phones, if that's been resolved. And they're also wondering if we know if people are able to, if you call 988, are you able to be connected to the locality in which the person in crisis is at the time? And that, that gets to an issue that I know we've talked about in the disability rights space a lot, about the ability to locate people based on where they are. And because if you call from a cell phone number, if you call from a Louisiana cell phone number, but you move to California and you call 988, the question, I guess, is, would you be directed to a crisis call center in your new California community? And it's my understanding that that is the way that it's supposed to work, as long as that community has the capacity to answer those calls. So again, if you had existing hotline numbers, if you called 988, you would be automatically connected to those existing hotline numbers. But if you don't have that, then I think the call is answered in a national hub somewhere, the nearest national hub. That's my understanding. AJ, Greg, did you have anything there?
This is AJ speaking. So From my understanding, there are still some problems with cell phones being routed to their local number. So if you are from Florida and have a Florida area code, but you are in Georgia, it may route back to Florida. It depends. And I know there are also a few concerns about geolocation data, because I know they were trying to fix that problem using geolocation data, but there are some privacy concerns, again, focusing on police response and sending police to folks who aren't wanting to have police there, and thinking about involuntary commitments potentially. So there's still a bunch of things that need to get worked out. So I'm not fully sure about that question. I think it's a good question, and I wish I had a better answer. And if there are answers and I don't know them, I would love for someone to provide resources.
Yeah, I think the concern that AJ was laying out was also what Greg had mentioned, which is that in most cases, if you call 988 or really, a lot of crisis numbers and you need on the ground assistance, somebody decides or you ask for on the ground assistance, unfortunately, because we don't have a national, civilian crisis response system, you're still going to be getting a police response in most cases. So the whether or not they can track your exact location when you call 988 can be a dicey issue for some people who don't want their location known and who certainly don't want police presence at their location. That has been also the subject of a government report where that has happened. People have called 988 thinking that they had complete anonymity, and unbeknownst to them, law enforcement showed up at either their school or their workplace or home later because maybe they were deemed suicidal or violent or something along those lines. And then we had a question in the chat about military training. And somebody's basically saying that a lot of police officers are former military personnel, and that that sort of military line of thought is probably deeply embedded in their framework and how they approach police work once they become police officers. What suggestions, in your opinion, can help deprogram or reprogram former military personnel who are now serving as police officers back into the civilian world? Greg, AJ?
This is AJ. I know that Greg had a good definition for policing that kind of goes to the ethos of policing beyond just military personnel who become police officers and law enforcement officers. Greg, if you wanted to talk about that.
Yeah, just as I sort of discussed in the slide, I think one concern is that the predominance of police training is about what are generally seen as the essential functions of police to thinking about when police enter a situation. They are there to assess and detain and potentially use force if there is an incident. And I think that is so much the crux of police that even in neutral situations, they are first going to be there. They're first going to be investigating. And that does mean, I think that calls into question whether police really should be part of a social service response, because in many of those situations, you don't want an investigative approach. And I think that's not limited to veterans, that's not limited to military. I do also think there is a risk in some police training of reinforcing that mentality across all services. So I think a lot of press have raised concerns about so-called warrior training as encouraging and reinforcing a mindset around use of force that is incredibly dangerous. I would definitely co-sign that, but I do think that it is a much more pervasive, pre-existing component of policing, and what police work is focused on and about that really is the core issue here. And I think, to be frank, if you think police are essential, you also see that as an essential part of what police do and what they should be doing. And I don't think you can actually fully divorce that. So I think that's part of why I would argue for removing police from situations where that police-based approach is not the desired trajectory and outcome.
And we have, thank you. And we actually have a clarification to one of the questions about how 988 calls are routed. And this is from Shannon Scully at NAMI, who follows the developments of 988 quite closely. So she says, 988 calls are currently routed based on area code. The FCC has not made any policy related to routing calls based on physical location. There is lots of advocacy work going on to support calls being connected locally to support connection to local resources, but also supporting confidentiality with 988. Okay, thank you, Shannon. And then we had more of a comment here from someone who says that I've learned the #1 goal for all police, at least in my county, is to go home alive. This kind of perspective becomes a big challenge, particularly given the intermittent, truly dangerous situations that they experience. And I'll respond and then ask Greg and AJ to respond. Yes, I agree. Policing can be a dangerous job, but I also think that the #1 goal for somebody who picks up the phone and has to make that very, very difficult decision to call for help for somebody who's in a crisis is for their loved one to come back to them alive, to get the help that they need without being killed during that encounter. You know, I have actually heard parents on the phone who've made that decision to call 911, because that's generally the only option, say to the dispatcher, you know, my son is having a mental health crisis. My son is Black. Do not kill him. So, you know, to have that burden, fearing for your son or daughter's life, fearing that your child is having a mental health crisis, you need additional resources. It's beyond what you can do yourself, but fearing that those additional resources may actually be the ones to harm your child, I think is an unfair burden for people of color and people with disabilities to have to bear. And it's a very real burden. So I will ask AJ and Greg to sort of chime in there. Would you like me to?
Well, I think you said most of it for me. I do think, yeah, no, I think what you said about why people seek crisis lines, why they seek help, and it's a really devastating thing to have to seek help from a crisis line, and knowing that you're assuming a risk that this may harm somebody. And I think that is not how we want the system to work. And I think if you believe that this is the necessary and proper role of police, then it's also important to sort of distinguish that from the sorts of things where we are calling for people experiencing mental health crisis, that we don't want people approaching every support need as a potentially dangerous situation, because that makes it a dangerous situation for people. And I think that is part of why we do really do want to see a separation between these two services.
AJ, did you have anything?
Yeah, this is AJ. I would also say that it's really dangerous to frame police interactions with folks going through mental health crises or having intellectual, developmental, or mental health disabilities as being dangerous. Disabled folks are more likely to be the victims of violence and use of force than the perpetrators. And so I think it's really, really bad to frame, especially crisis response, as being more dangerous for law enforcement officers or responders than the folks who are actually experiencing the mental health crises.
Thank you. And then we have something here that I think all of our groups, you know, who are part of the disability rights community can take ownership over. Someone says, are there universally designed and accessible tools to share with folks with disabilities and diverse learning styles about alternatives to 911? Tools for young even preschool up to high school age folks with disabilities, maybe videos? It sounds great. I don't think we've developed those tools yet or those resources, but it certainly sounds wonderful. What do you all think as an organization that of people with autism?
Well, I know that we have a number of resources on policing and police violence that I definitely encourage everyone to check out. We do have a fairly long toolkit on racial disparities in community living, but one section of it does focus on policing and incarceration and the impact that has on people with disabilities. I know that we also have a few somewhat older resources, I think a year or two prior to that, also focusing on policing. So I can, yeah, check out our website. Basically, we do actually do a lot of work on plain language and easy read. So for accessible resources in particular, I think we that is an area of focus for us. So
And then there's a question here which is really important. It says, what role do you see residential providers providing in home or residential care services in crisis response when working with people with physical disabilities, mental health needs, or IDD? They seem to often be the middle person between responding and then between being responders and the people in crisis, I guess. So how do you think they should fit into our community responses or models? And the reason I say that that is a super important question is because, yeah, if you are a service provider, you're a care provider, whether you're in a home or you're in like a school setting or a facility setting, oftentimes service providers do make that determination to pick up the phone and generally call 911 for certain crises and interventions. And I've seen videos of young Black girls who are in facilities or school settings, very clearly with disabilities. Somebody has made the decision, a care provider has made the decision to call for help. Help has generally been an armed law enforcement. I have seen an armed male law enforcement walk up to a young Black girl who's about 14 and punch her in the face. And that was his way of handling her acting out in that situation. So bringing in care providers and making sure that they have resources and that they know about alternatives and how they can be advocates for people who are more likely to suffer this type of harm during a crisis, I think is important. I think it's something we need to do. So what role do you see residential providers providing for people particularly with IDD, Greg, AJ, in crisis?
This is AJ. Can you reframe or simplify
Yes.
the question, please?
Yes. What role do you see residential providers providing in-home or residential care services in crisis response when they're working with people with disabilities?
Okay, this is AJ. I think first we need more DSPs, and we need more funding to adequately pay folks to provide HCBS in folks' homes. I think the question points to a broader problem in that there isn't enough HCBS funding. There aren't enough care support workers available right now. And so the role that they can or could play is something that we don't really have the ability to judge or understand, because there simply aren't enough folks there to, like, we don't know how many crisis incidents have been prevented by DSPs or other direct care providers, just because there aren't enough, and there aren't enough folks receiving that. So I think that's a really difficult question to answer, but I do think it's really illuminating towards the fact that we need to invest more in HCBS funding to provide people with the direct support staff that they need.
Did you want to make any comment there, Greg?
I think AJ covered, I think, a critically important part of it. I think ensuring that people are able to get the services that self-directed services that support them in the community. I think when, again, there is this challenge, I think, when we're talking about residential settings and residential providers around sort of the constraints and the constraining nature of residential settings. And I think those in some ways do put providers in a even more invidious situation where people may not be getting the supports that they need, and that's what leads to a crisis situation. So I think, so yeah, reiterating what AJ said, I think HCBS is a really critical part of this, and ensuring that people are able to get adequate and supports that meet their needs through that system, and that support workers are adequately paid, and that people, and that everyone with a disability is able to get those supports, I think is a really essential part of this. I think I also want to expand on that a little bit and say that staffing issues are also critically important for mobile crisis teams. I mentioned this in passing before, but a lot of times when they're diverted to police, it's because of lack of training or on the part of dispatchers, or alternatively, understaffing to the level of demand among crisis teams. So I think in both cases, that's another place where there's a lot more investment that's needed, and especially to the extent that crisis response services are very locally driven, that is a very shallow pool of funding, and we need to do as much as we can to ensure that that all these services are adequately funded in concert.
Thank you. And thank you all for AJ and Greg for getting us back on time too. We're like back on time. And I do want to close out with this one question very quickly, and then we will leave, give people about a 5-minute break before we get into our session on youth and crisis response, which is, what steps can be taken to disentangle police from crisis response?
This is AJ. I don't want to take up too much time because Greg and I talked about this before, and we're really glad we're back on schedule. But I think, one, we have to stop criminalizing different behaviors. A lot of times, because of systemic ableism and disabilitophobia, we criminalize and punish behaviors that are just different, especially folks who have ID or are autistic, or have any other kind of disability. So I think that's the first thing, is to stop the criminalization of behavior. But two, going back to points that Greg and I have both made, we have to reinvest in community support services, and not just services and supports for people who are disabled or experiencing mental health crises. Like, something we talked about was access to affordable housing, and that helps everyone, right? Not just folks who are disabled or experiencing a mental health crisis, and providing better community care and support. So I think that it would be the very first thing that we have to do in order to decouple police responses to crisis intervention.
Greg.
AJ said it, honestly. I think that was
Well, thank you all. Thank you, Greg and AJ, for your hard work preparing for this panel. Thank you to all the attendees. Greg and AJ, can you hang out in the main lobby and interact with people? People can continue to put questions for you in the main lobby chat if you have time to do that.
This is AJ. Yeah, I'm happy to. And I guess, Carlene, can you drop my email? Because I know there are some questions we didn't get to.
Okay, yeah, I will go ahead and put AJ's email in the chat, and we will be resuming in just a few minutes for the panel that we have that is specifically focused on youth needs around crisis response. And I think you're going to hear some very interesting things there, because not a lot of us think about youth with disabilities and youth and what their needs are around crisis response in general. So I am putting here's AJ's email. Oh, and it's also under the speaker profiles for most of them, says Juan. Thank you for the panel. You guys are getting a lot of, you all are getting a lot of responses in the chat for the panel. And okay, so AJ and Greg will be in the lobby, and we'll see everybody back for the youth session in just a few minutes. Thank you.